informed consent. Adverse reaction, reported allergies to COVID shot. Seek your family doctor's advice. The Center for Disease Control, CDC, is reporting COVID shot hypersensitivity, producing mild to severe, including death, anaphylaxis, in the clinical trial responses. The CDC is monitoring the data coming in regarding the risk of serious adverse events due to hypersensitivity to synthetic medical compounds. Specifically, related to COVID shots, the synthetic compound, PEG. Vaccine participants, presenting for trial, with a history of allergies, specifically to medical synthetics. The CDC advises the following actions: 1. Do not vaccinate. 2. Refer participant to seek further consultation. The CDC is advising vaccine administrators to consider referral of trial participants to an allergist immunologist prior to participating in the COVID trials. Due to the Pfizer-BioNTech and Moderna injections being lipid nanoparticle formulated, nucleoside-modified mRNA injections, they contain certain synthetic compound, called PEG. The CDC is proceeding with caution, as this is the first time such a trial has ever been done using a synthetic compound on such a large selection of humanity. Unfortunately, none of the currently authorized COVID-19 vaccines are live virus vaccines. This leaves those with a history of sensitivity to medical synthetics with no reasonably safe vaccine option. Therefore, the CDC is directing all participants to seek the advice of their trusted family doctor. The synthetic compound, polyethylene glycol, PEG, is an ingredient in both mRNA COVID-19 vaccines, and polysorbate 80 is an ingredient in the Janssen COVID-19 vaccine. According to the CDC, PEG and polysorbate are structurally related, and cross-reactive hypersensitivity between these compounds may occur. This makes it a risk factor for possible adverse events due to a participant's underlying sensitivity to synthetic medical injections. All COVID-19 vaccines are free from metals such as iron, nickel, cobalt, lithium, rare earth alloys, or any manufactured products such as microelectronics, electrodes, carbon nanotubes, or nanowire semiconductors. The following considerations can be used to help you and your family doctor conduct a risk assessment for vaccination. Assessment starts with establishing an individual's risk of exposure to SARS-CoV-2, COVID-19. Once risk of infection is established, then the next step in a proper individual assessment is to establish the risk of severe disease or death due to COVID viral pneumonia. The risk, currently at 7 out of 100 as per the CDC, of anaphylaxis, including fatal anaphylaxis, following a COVID shot. Lastly, an assessment would take into account, for your ability to be vaccinated, where appropriate medical care is immediately available for anaphylaxis. Allergic reactions, including severe allergic reactions, not related to vaccines, COVID-19 or other vaccines, or injectable therapies, such as allergic reactions related to food, pet, venom, or environmental allergies, or allergies to oral medications, including the oral equivalents of injectable medications, are not a contraindication or precaution to the available COVID shots. For people with these precautions, referral to an allergist immunologist should be considered. Anyone considering participating in the COVID trial is strongly advised, as per the CDC, to consult a trusted family doctor before receiving a COVID shot. Doing so will give you and your doctor the opportunity to review your medical history, determine if the shot is for you. Please join our MiniDocs community. MiniDocs Media tries to bring its community valuable information in an easy-to-digest format. The information presented in this talk was sourced entirely from the archives and reporting of the Center for Disease Control and Prevention, CDC. Please take a minute and watch our 60 seconds short on this topic to learn more valuable information.